Today's mini video is going to focus on 2024 attestation, tips for successful attestation preparedness. I'm Jessica Elliott at the Kentucky Regional Extension Center, and we are going to walk you through all of the things you need to know to make sure that you have a successful attestation for this performance year. In this mini video, we will take a few moments to review some of the program requirements for 2024's QPP program. Then we are going to talk about some tips and tricks for a successful attestation, the type of documents that you need to prepare and have ready to hit the ground running as soon as that attestation window opens. We're also going to talk with you about some documents to retain and to the steps that you need to take in order to be prepared for that audit process in the event that it does occur. And then finally, we are going to discuss some different resources that are available and flexibilities that are available for you in your practice. So now let's take a quick look at eligibility. Right? To be an eligible clinician in the quality payment program, you have to meet several criteria, especially participating in that MIPS track. You want to make sure that you're an eligible clinician type. That's going to be in that gray box at the top of the slide. Then you're going to want to make sure you exceed the low volume threshold. You have to meet all three criteria of Medicare billing Part B, patients that are associated or attributed to a clinician, and then have enough covered professional services in order to exceed that low volume threshold. If you only meet one or two of those criteria, you can choose to opt into the program. If you choose not to opt in, you are not subject to that positive or negative payment adjustment. If you're a qualifying participant in an advanced alternative payment model, you would not be able to necessarily participate in the MIPS track of the quality payment program. You would participate under that advanced alternative payment model. You also have to be an enrolled Medicare provider before 2024. And just a quick reminder, the 2024 submission window opens on January 2nd, and it runs through March 31st of 2025. Now let's talk about your participation status and how do you know if you are opt-in eligible or if you are required to report for the program. One of the things that you want to do is you want to download your connected clinicians on the QPP portal. You'll go into the eligibility and reporting tab and you'll be able to download the connected clinician list. You do want to make sure that you save that updated list, and if you have any of those connected clinicians that are required to report for the program, meaning they meet all three of the low volume threshold, that provider needs to have an attestation under your tax ID. Now, you have a couple different options. You can report for those clinicians individually, or you can report for those clinicians at the group level. You want to make sure that you meet at least one of those low volume thresholds if you are going to report at the group level. You will see that green MIPS eligible box checked underneath the practice if you're able to report at that group level. And we'll talk about reporting a little bit later on. Let's dive in to how CMS determines eligibility for the program. CMS is going to take two snapshots. That first snapshot, or segment 1, is going to begin on October 1st of 2022 and run through September 30th of 2023. They're going to then take that segment 2 snapshot. So if you're not eligible in that first snapshot, you're typically not going to be eligible or required to report in that second snapshot. But the second snapshot starts that following day. It's again going to be October 1st of 2023 and run to September 30th of 2024. Your final eligibility or your final determination is going to be available typically in early December of this year of 24. As I mentioned earlier, if you're not listed as required to report in segment 1, you are typically not required to report in segment 2. We always advise you to check your final determination before determining if you are exempt from MIPS reporting. Final determination is what is binding and official for the program. If at any point, though, you do see that green box at the bottom with that green check, MIPS eligible, that does mean that you are required, either at that individual level at least, to be able to report. Now, for the category weights and payment adjustments, we haven't seen any changes in a couple of years to the category weighting. Promoting interoperability is still 25%. However, it has expanded to 180 days. So don't forget that. We still have improvement activities for 90 consecutive days. We have cost that is at 30%. And again, that is no submission. However, it is going to be for claims throughout the entire performance year. And then finally, you have quality, which is 30% of your performance, and that starts from January 1st to December 31st of 2024. Always keep in mind, too, that the performance year 2024, you're going to see those positive or negative payment adjustments hit in 2026. Now, the threshold to avoid penalty is 75 points. They have continued to hold that threshold. Anything that is above 75.01 to 100 points, there is a potential for a positive payment adjustment. It is a sliding scale, so the closer you get to 100 points, potentially the higher the positive payment adjustment. Anything below 75 points is going to get some type of negative payment adjustment up to a full 9% penalty. A couple just category basics to keep in mind for quality. You have a total category raw points of 60 points, plus any administrative claims measure that trigger for your individual clinician or your practice. You are also going to be able to report 6 measures, at least one of which has to be an outcome or a high priority measure. You have a variety of submission options that you can choose from. It's EHR reporting and reporting ECQMs. There could be MIPS CQMs if you're reporting through a registry. If you're a small practice, you can report Medicare claims. And if you choose to report CAPS for MIPS, you would report that as well. Now, the reporting time frame, as I mentioned, is 365 days, and you are required to use the ONC CERT criteria. Now, for the cost category, this is going to depend on the number of measures that you trigger for. You have to be able to meet the case minimums for these measures in order to be required to report. There are up to 29 available measures for the cost category for the program for 2024. Again, no submission is required. Your performance is going to be based on the Medicare claims bill during that performance year. Improvement activities. That is worth 40 raw points for that category. You're going to have a composition of either 2 highly weighted activities, 4 medium weighted activities, or 1 highly weighted activity and 2 medium weighted activities. So you can kind of mix and match whatever is appropriate for your practice. There are some flexibilities in reporting that you can have a higher weighted score. In particular, if you have a special status, if you are a small practice, you would only have to report 1 highly weighted activity or 2 medium activities. And then for the promoting interoperability category, the raw category points available are 100 points. If you're a small practice, you get automatic small practice reweighting of this category. There are 4 primary objectives for this category. You also have some attestation statements that are a part of the program that are sort of a hard stop. You also have to attest to having completed an SRA, as well as completing the high priority guide of the SAFER guides. And the promoting interoperability category also requires the use of ONC CERT criteria. Now let's talk about some successful strategies that you can implement as a part of your attestation. We first want to really talk about how you want to participate in the program. I touched on this a little bit earlier. The program is based on individual clinician eligibility, right? And it's that unique NPI number and the tax ID number that's associated together. So if you have 3 clinicians in your practice, only one of them is required or eligible to report, meaning they meet all 3 low volume criteria, you have an obligation to report under that tax ID for that individual clinician. Otherwise, they could be subject to that full 9% negative adjustment. Now, you can also choose, if you have that one individual clinician who is required to report, you can choose to report at the group level. Therefore, all 3 clinicians could potentially achieve a positive payment adjustment depending on your performance. So that's really a decision that you would have to make. There's also a couple different factors on what plays into being able to report at that individual or that group level. There's also an option for virtual groups. This is something that you have to elect to do, and this comes into play if you're an organization that perhaps has multiple tax IDs and you can aggregate your data together to report as a virtual group. Now, a couple different steps to really get you started. First and foremost, you need to make sure that you have access to the quality payment portal. You do have to periodically update your password, so making sure your password is ready to go and up to date is that first step. You want to make sure that the security official is in place within the QPP portal, that you have that person designated. The security official does not have to do the attestation, but you do need to make sure that you do have one that's associated with your tax ID. You want to make sure that you then reconcile the list of clinicians in that QPP portal. We showed you earlier where you can download that connected clinicians list, and you want to make sure that that is up to date and as accurate as possible. And then next, you want to go into PAYCOS. You want to make sure that all of your information is up to date. We always recommend going and doing this early in the performance year, and any time that you do have changes to your providers as they leave and enter into your organization. It does take time when you make adjustments in PAYCOS for it to ultimately trickle down into the QPP portal, so do keep that in mind. Now is a great time to just do a quick review of your connected clinicians and make any updates to PAYCOS before they make that final determination. Next, you want to prepare your documents to retain. We have a step-by-step document here at the Kentucky REC that we share with you. This is your documentation process. This, again, helps ensure that you have all of the materials noted, pulled together, the reports properly vetted to be able to have a successful attestation, and that you have all of the documents to keep close by should you have an audit from CMS. Next, during that final 90-day period, as you're wrapping up the performance year 2024, you're going to want to make sure you pull your Chapel ID, and you want to make sure that you have all components of your cert whenever you are generating that cert ID. If you have any issues generating that cert and you would like us to help you with that process, we are here to do that. Just reach out to your advisor and we can walk you through pulling that Chapel ID. Now, we want to also make sure that as you are preparing for attestation, you have met with your vendor, that you have discussed with them your vendor's capability to report. There are some certain circumstances that have happened over the years where vendors have had technical issues or they have lost their ONC certification. And so we want to make sure that we do a touch base with our vendor on their capability to report for the program. You also want to make sure that you touch base with your vendor on their timeline. When will they have either the JSON or QRDA3 files available for you? You're going to want to confirm the vendor process. Are they going to be pulling the report and pushing it to you for you to upload? Do they have an API connection, a direct connection to CMS? And they are going to upload that report for you. So you want to get a feel for what that's going to look like. There's even the option with some vendors that you can generate the QRD report yourself within your organization. You want to make sure that you have an opportunity to audit the data. If they have automatically uploaded that report, talk with them about, are they able to give you some information around your performance prior to that upload? Same thing with any report that they would send you. And then finally, you want to talk talk with them about what specific categories they are going to report for. Some EHR vendors and some registries are able to report all three categories: quality improvement activities and promoting interoperability. If you intend to do a manual attestation for improvement activities and promoting interoperability, you want to make sure you get that clarified with them. You don't want to have any information in your QRDA3 file for those two categories because that would then be a submission of those different activities. So again, if you're just reporting quality through your vendor, you want to just make sure quality data is associated with that QRDA3 file. Again, the QRDA3 or the JSON file formats are the two acceptable formats for uploading data. You are not eligible to upload something like an Excel file. Now, just a couple tips and tricks for us to go over around attestation. You are going to want to first take a look at, do you qualify for any hardships or EUCs? EUCs are going to be determined based on any sort of extreme and uncontrollable circumstance. If your EHR loses cert during the year, if you have experienced a natural disaster, there are some potentials to apply for an EUC. Most of us are familiar with the COVID-19 EUC. We want to make sure that we verify the accuracy of all of our reports, right? We want to make sure, first and foremost, that all of the providers, especially when we're reporting at group level, that all of our providers are represented in the data. We want to verify the numerators and denominators and make sure that those pass that sniff test, that all of your data is included whenever you're reporting, and to make sure that your reports are functioning as they should. I mentioned on the slide previously that you do want to make sure that only the relevant data that you're intending to submit for is contained in that QRDA3 or JSON file. You also want to make sure that you've selected appropriate improvement activities that meet that 90-day threshold, and that you have the documentation associated with those improvement activities, and that they meet at least 50% of the clinicians that you are attesting for have participated in that improvement activity or activities. One thing to keep in mind is attestation can begin with any category. You also have some opportunities to, if you have uploaded your data, to re-upload your data. Keep in mind that the last thing that you upload is typically going to be what CMS counts as that final submission. So do one last check before the attestation window closes to make sure that no one else has gone behind you and uploaded data that could have overwritten what you believe is that final data. Believe it or not, it has happened before. Something else we want to just remind you of is, as you are going through the actual attestation process, you want to make sure that you are capturing screenshots with a date and time stamp all along the way. As an advisor, when we are helping you, we try to remind you of the different screenshots we want you to take that show that you have submitted for the categories you intend to submit. We highly suggest that you keep both electronic and paper copies of all of your screenshots, all of your reports, all of that documentation. You want to have it saved electronically, and then you want to have it in that folder in the event that you have a data loss in your computer systems, or in keeping paper copies for it as a backup. And then also too, you want to make sure you keep that digital file and transfer that as people leave the practice. You want to make sure that that data stays with someone who is actively associated with your organization, but you also want to keep those paper files just in case something like that does happen and you do lose that electronic access. As an advisor, something that I try to stress to each and every one of my clients is that we have to be prepared for an audit. CMS retains the right to audit your submissions at least 6 years after your performance year. So again, they have this window Typically, they haven't taken the full 6 years. Usually it's within a year or two of the performance period. However, CMS themselves advise that they do have this flexibility to go back at least 6 years. And so that's why we thoroughly encourage you to retain all of your documentation for at least that time period. Again, making sure that documentation is printed out in a binder as well as saved electronically. Some of the information that is really important to go in that binder or to go in that file is you want to make sure you keep copies of all of your quality reports, anything that you would have submitted. You also want to make sure that you have your connected clinicians list that you downloaded and any other documentation that shows your providers and the locations or the tax IDs that they're associated with. And you also, again, want to make sure that you capture any screenshots from your EHR in the process of generating your reports that might be relevant to keep. Improvement activities, you want to make sure that you are keeping all documentation for each activity. You want to make sure that those activities, you're pulling information from, you don't have to have information from every single clinician if you have a large group, but you want to make sure that you have documentation that covers those clinicians, that you have an established process or a protocol related to that particular activity, that you can, if you're attesting that they have participated in some type of training, that you have screen grabs that they have completed that training or copies of certificates related to that. Again, half of your clinicians do need to attest for that activity. We also, if it's an activity that you're monitoring over a period of time, something like 24/7 access has been a really common one that practices have used. We recommend that you take snapshots or screen grabs at the beginning of your attestation period, at the beginning of the 90 days, if you can get one in the middle and if you can get one toward the end to show that those activities are ongoing. And then promoting interoperability, you want to make sure that you retain any reports or screenshots from your EHR. You want to download that Cert ID report from the Chapel website. You also want to make sure you get that list of NPIs and those locations those providers are associated with, any type of agreement that you have for your public health registries. If you have manually aggregated data for your clinicians to report at that group level, you want to make sure that you keep the actual data calculation. So if you've done that in a spreadsheet, if you've handwritten it out on a piece of paper, you want to make sure that you keep that to show how you added the data together to report as a group. Again, we want to make sure that you have all feedback reports whenever you've submitted, either at that preliminary submission and then that final submission where you have your final adjustment factor and your final score. You want to make sure you have all of those files out of the QPP portal, as well as any screenshots of those different data elements. You also, again, as I mentioned too, that preliminary scoring is really important, especially if there is a change in your score or there's a change in the calculation. By the time the final scores are released, you can compare and contrast that. Now let's briefly talk about some of the resources that we have attached. You'll also receive a copy of this slide deck as well as this recording. So extreme and uncontrollable circumstances, I touched on that a little bit earlier. There are limited events where you can use this EUC. First and foremost, if you are unable to collect information necessary to report for the program. This doesn't mean that you don't have that you can not have a certified EHR, or this doesn't mean if you chose not to upgrade your EHR to the certification standard. This is more in place if your EHR loses that cert designation during the performance year, that you would not be penalized for it. You would also be able to apply this if you have had some type of an outage where you're unable to report for a particular performance category for an extended period of time. Also, you would be able to report if your normal processes are affected for your performance around the cost category or other administrative claims measures. You can submit an EUC for this. CMS has also announced an EUC that is available for those impacted by the Change Healthcare data breach that occurred earlier in 2024. We know this impacted billing practices for quite some time for several of our clinics and groups across the state of Kentucky and nationally. So if you feel that your organization has been negatively impacted by this data breach, that is an opportunity on the table to reweight one or more of your performance categories. Eligible clinicians, groups, and virtual groups are able to apply for reweighting to one or all MIPS performance categories. The EUC application window is currently open. You do have until December 31st at 8 p.m. To apply for an EUC for performance year 2024. You will receive a notification by email if your request has been approved or denied. Again, if you do submit an EUC, you would want to put that as a part of your clinical documentation for your attestation. They're also promoting interoperability hardships, as well as that automatic reweighting flexibility. So those folks who can qualify for a PI hardship, that's a small practice, is going to get that automatic reweighting. As I mentioned earlier, if your EHR technology is decertified, if you are in a geographically determined internet connectivity area. So there are some geographic regions that have been determined by the federal government to not have sufficient internet connectivity. And so if you are in one of those zones, you could potentially apply for a PI hardship. Again, the EUC does apply and can be used as a PI hardship as well. And then again, lacking control over the availability of CERT. That again does not mean that you choose to not upgrade your EHR or you do not have an EHR, but rather that your technology, your CERT is not available, your EHR is not available. So clinicians groups and virtual groups are also able to apply for a PI hardship exception. And again, you have that same window, that same time frame of December 31st at 8 p.m. For performance year 2024. The automatic PI reweighting that I mentioned earlier, again, that applies to that small practice designation. Small practice is defined as 15 or fewer eligible clinicians tied to a tax ID. You can also be deemed non-patient facing at that individual or that group level, hospital-based. You can be an ambulatory surgical center. Something for 2024, we've historically had different clinicians that have been automatically exempted from reporting PI. However, CMS finalized in previous rulings that in 2024 there are no other clinician types that are going to be eligible for that automatic reweighting. So if you are considered an eligible clinician based on that previous slide, there are no additional flexibilities for this. This slide just details some of the common reweighting scenarios that we have for promoting interoperability. You'll notice that small practices do have special weighting that looks a little bit different than our larger practices, whether they choose one or two performance categories to reweight. And then finally, if you do have any questions, please reach out to us at the REC. You can email us directly. You can also reach out to your advisor to help you navigate this process and to provide you with any information, any of our audit and attestation prep documents. We'll be reaching out to you in the coming months to get prepared. So thank you very much.